You lie down. It's quiet. Then, that dull ache starts in your calf. Maybe it's a tight feeling. Maybe it's a throb that won't go away. You shift, stretch, rub it a little. It helps, but only for a while. You think it's just your age. Maybe you need more calcium or magnesium. Maybe it's from standing all day. But what if I told you this pain, especially if it shows up at night, in the same spot, again and again, could be your body's quiet warning of something more serious? Something called peripheral artery disease, or PAD, a condition that affects 1 in 5 people over 60 and often goes undiagnosed until it's too late. In this video, you'll learn how to tell the difference between ordinary leg cramps and the pain of restricted blood flow. We'll walk through 5 signs of PAD that most seniors miss, share real patient stories, and show you exactly what questions to ask your doctor. Because this isn't about fear, it's about awareness and action. Let's begin. Sign 1. Calf pain that shows up at night, even when resting. One of the first and most overlooked signs of PAD is pain in your calf, foot, or lower leg that appears at night when you're not even moving. You might feel a deep ache in your calf, a heaviness, a tight cramp that slowly grows the longer you lie still. Some people describe it as a squeezing, others as a dull throb that only improves when they hang their leg off the bed. Why would that help? Because PAD is a condition where arteries in your legs become narrowed or blocked by plaque buildup. This restricts blood flow, especially to your legs and feet. During the day, gravity helps. Walking helps. But at night, when you lie flat, the blood flow drops even further. Your muscles are starved for oxygen, and they protest. Mr. Franklin, 72, thought he was just getting old. I figured I needed magnesium, he said. I bought supplements, took warm showers. It helped for a week. But the pain came back every night. Eventually, he noticed his foot looked pale and cool in the mornings. His doctor ran a simple test called an ankle brachial index, and the result was clear: moderate PAD in both legs. The key difference between regular leg cramps and PAD-related pain? PAD pain happens without movement. It doesn't respond well to stretching, and it often improves when you dangle your leg down, letting gravity help blood flow. If your legs ache when you're trying to rest, and it keeps happening, don't write it off as just age. Ask your doctor. PAD can start silently, but once it progresses, the risks grow, from ulcers to infection, even amputation. You don't have to live in fear, but you do need to listen, because your legs might be hurting for a reason you haven't heard about until now. Sign 2. Pain when walking that disappears with rest, claudication. Imagine this. You're walking down the street, feeling fine. After 2 or 3 blocks, your calf starts to ache. Not a sharp pain, but a burning tightness. You stop for a moment, maybe to tie your shoe or check your phone, and like magic, the pain goes away. You keep walking, and like clockwork, the pain returns. Most people think it's just muscle fatigue or old age, but this classic walk pain stop relief cycle is actually a textbook symptom of PAD. Doctors even have a name for it: intermittent claudication. When your leg muscles move, they demand more oxygen. If your arteries are narrowed by plaque, the blood flow can't keep up. Your muscles cry out literally. That ache is oxygen starvation. The moment you rest, your muscles relax, and the limited blood flow becomes enough again, so the pain vanishes. This exact pattern is what happened to Mrs. Alice, 69. She loved her morning walks, but for months, she had to stop every 10 minutes to massage her calves. I just thought I was out of shape, she said. But after a neighbor mentioned PAD, she visited a vascular clinic. A simple Doppler ultrasound revealed significant arterial narrowing in both legs. With medication, exercise, and dietary changes, Alice is walking further now, without stopping. The tragedy is that so many people ignore this sign. They blame themselves, thinking it's weight, age, or bad shoes. But PAD pain is predictable. It always comes back in the same spot, at the same distance, and eases with rest. That's the pattern to remember. Don't wait until walking becomes impossible. The earlier you identify claudication, the better your chances of reversing the damage before it escalates. Your body is trying to negotiate with you, step by step, Listen before it stops asking and starts shouting. Sign 3. Cold feet, pale skin, and slow healing sores. You touch your feet under the blanket and realize they're cold. Not cool. Cold. You try rubbing them, putting on socks, using a heating pad. They warm up for a bit, but always go back to feeling icy, pale, or even numb. Or maybe you scraped your shin weeks ago, and that small wound just won't heal. It's dry, discolored, or even starting to darken. For seniors, it's easy to blame these things on poor circulation, diabetes, or even bad skin. But chronic coldness and delayed healing, especially in the lower legs and feet, can be one of the most serious signs of peripheral artery disease. When arteries become narrowed due to plaque buildup, oxygen-rich blood struggles to reach the farthest points of the body, your toes and feet. Without proper blood flow, the skin cells don't get enough oxygen or nutrients to stay warm, repair themselves, or fight off minor infections. Mrs. Loretta, 74, had a small scratch from gardening. It was the tiniest cut, she said, but it stayed open for over 2 weeks. Then her toes began to look pale and feel colder, even in the summer. She went in for a vascular checkup and discovered critical narrowing in her femoral arteries. Thankfully, she caught it in time. With treatment and circulation therapy, she avoided the terrifying road toward non-healing ulcers, gangrene, or even amputation. One thing doctors always say: skin doesn't lie. If your feet are noticeably colder than your hands, if the skin on your legs looks shiny, pale, or thin, or if small wounds take more than 10 days to heal, don't wait. These aren't just cosmetic issues. They're signs your cells are starving for blood. PAD is sneaky. It doesn't always start with pain. Sometimes it starts with silence and coldness. And if you listen early, you can warm the problem before it freezes into something worse. Sign 4. Hair loss on legs, brittle nails, and weak or missing foot pulse. When we think about circulation, we don't usually think about hair. But take a moment. Look at your lower legs. Has the hair stopped growing? Do your legs look shiny, smooth, almost polished, but not because of skincare? Or maybe your toenails are brittle. They crack. They grow slowly, or not at all. These small, silent changes are often dismissed as part of just getting older. But in many cases, they're not cosmetic, they're circulatory red flags. Hair follicles and nail beds are incredibly sensitive to blood flow. When arteries in the legs narrow, the first thing to suffer is the smallest, most peripheral structures, like hair roots and nail tissue. And because they grow slowly, the signs of poor circulation show up here long before pain or sores appear. Mr. Elliott, 71, noticed he hadn't shaved his legs in months, not because he forgot, but because there was nothing to shave. The hair had simply disappeared. I thought it was just hormones, he said, until my doctor couldn't feel a pulse in my foot. That's another silent sign, a weak or missing dorsalis pedis pulse, the small artery on the top of your foot. A trained clinician can feel this with their fingers, and if that pulse is hard to detect, it's a clue that major arteries are clogged upstream. Elliot was diagnosed with advanced PAD. He hadn't had pain, just a patch of hair loss and brittle nails, but inside, his arteries were 70% narrowed. PAD doesn't always scream. Sometimes it whispers through your skin, your hair, your pulse. If your legs have changed over the years, not in weight, but in texture and life, it might be time for a vascular checkup, because your body is telling a story. You just have to know where to look and what it's trying to say. Sign 5. Erectile dysfunction in men, an early vascular red flag. It's not something most men want to talk about, not to their doctor, not even to their partner. But if you're over 60 and you've started to notice erectile dysfunction, it might be time to look beyond hormones or age. Because in many cases, ED is one of the very first signs that your arteries, especially those in the pelvis and legs, are narrowing. Here's why. Just like your legs and feet, the blood vessels responsible for erection are small, delicate, and highly dependent on good circulation. If those vessels can't carry enough blood to the area, the body can't respond the way it used to. That's why some cardiologists and vascular doctors say, erectile dysfunction is not just a bedroom problem. It's a circulation problem. In fact, many men experience ED years before they ever feel leg pain or develop a sore that won't heal. And because the arteries to the penis are smaller than those in the heart or legs, they clog up first. Mr. James, 67, thought it was low testosterone. He tried supplements, changed his diet, even adjusted medications. Nothing worked until his doctor ran vascular tests and found significant narrowing in his iliac and femoral arteries, the main blood highways to the lower body. He was shocked. "No one ever told me this could be related," he said. After treatment, not only did his circulation improve, his blood pressure stabilized, his leg fatigue lessened, and yes, his confidence returned. ED doesn't always mean PAD, but PAD often includes ED, especially in older men with high blood pressure, high cholesterol, or a history of smoking. So if this is something you've been silently dealing with, don't be embarrassed. Be curious. Be proactive. Ask your doctor about PAD, because sometimes the most personal signs are also the most powerful clues that your vascular system needs help. PAD doesn't always arrive with a bang. Sometimes it arrives in whispers. A leg cramp, a cold toe, a slow walk, a silence you ignore. But ignoring these signs means giving disease a head start. The good news? PAD is treatable, especially when caught early. If any of these signs sounded familiar, don't wait. Talk to your doctor. Get checked. Comment leg check if you stay to the end, because that small step might just save a limb or a life.